Nurses with Chemical Dependency by Kelsey Main. Helpful definitions. Chemical dependency is defined as the body's physical and/or psychological addiction to a psychoactive, mind-altering substance such as narcotics, alcohol, or nicotine. Substance abuse disorder is the recurrent use of drugs or alcohol that impairs psychological and physical function and undermines the affected individual's ability to perform day-to-day activities and fulfill personal, family, or work responsibilities. Medication diversion means the transfer of a controlled substance from a lawful to an unlawful channel of distribution or use. Compassion fatigue is a recent concept that refers to the emotional and physical exhaustion that affects helping professionals and caregivers over time. Learning objectives. How to prevent medication diversion, how to recognize coworkers with substance abuse issues, how to be supportive of those coworkers suspected of having abuse issues, and how to report suspicions of substance abuse in the workplace. That is OSF specific. How is this topic relevant to you and me? In 2011, substance dependency was estimated at 2 to 10% of working nurses, and substance misuse or abuse was estimated at 14 to 20%. In 2018, the percentage of substance dependency jumped to 10%. Since the COVID-19 pandemic, reported instances of substance use have increased over 30%. In Alabama, 300 nurses a year are disciplined for substance use disorder, and 9,000 nurses a year in this country re-enter the workforce during or after recovery of a substance use disorder. Some signs and symptoms of substance use disorder among nurses: excessive call-offs, the nurse wears long sleeves during all weather, tardiness, frequent accidents on the job, unexplained absences from the unit where the nurse is working, long coffee or lunch breaks, excessive bathroom breaks, confusion about his or her work schedule, the nurse being in clinical areas when not working, early arrival or late departure, difficulty recalling instructions, excessive time needed for charting, assignments require more effort or time, volunteering to work holidays, night shifts, weekend shifts, or overtime, incorrect narcotic counts, unwitnessed waste of narcotics or controlled substances, impaired judgment, slower reaction time, increased number of errors, patient neglect. What to do if you suspect a coworker is diverting medications or has a substance abuse problem? Immediately talk to your manager or supervisor. It is not recommended to go to the coworker in suspicion because the coworker could deny the accusations, the coworker could become angry or violent, or the coworker could be shamed and not ask for help. I wanted to include in this presentation, if you personally are struggling with substance abuse of some form, alcohol, drugs, anything, recognizing that you have a problem is the first step. Addiction is a disease, and it requires and deserves appropriate treatment like any other disease. At OSF, if you admit to having a problem, you can request substance abuse treatment assistance from OSF. And there are many resources available to you, but the first step is asking for help. Some tips on how to prevent medication diversion. Always witness the wasting of medication. Other things employers can do is require education on signs of substance abuse disorder in coworkers and have resources readily available to every employee. Why are nurses affected by substance use disorder? There are several reasons. Lack of coping mechanisms, especially in high stress areas like the ER, the OR, or the ICU. We have ease of access to medications. We have so many medications at our fingertips that we can just take if we wanted to. Addictive personalities. I thought this was interesting. We are encouraged to pick up overtime. We are encouraged to work long hours. and that turns us into workaholics, which is a sign of having an addictive personality. It's an easy fix. Nurses want to take care of others. They don't want to take care of themselves. We don't eat right. We don't exercise. We don't drink enough water. We don't go to therapy. So medication diversion is an easy fix to some of those problems. Nurses are wearing more hats than ever. I don't need to tell you guys that more work is expected out of us for the same amount of time. We are expected to be housekeeping, respiratory therapy, physical therapy, social work. We are doing more than ever, and we are not, like, our role hasn't changed at all in that way. We work long hours and compassion fatigue. If you're tired, and like, it might help. You might think it might help, but it won't. How to support nurses in recovery or recovered from substance use disorder. The ANA Code of Ethics for nurses actually has a few requirements of nurses. In the ANA Code of Ethics, it requires nurses to have compassion and caring for colleagues re-entering the workforce after recovering or during recovery of substance use disorder. The ANA Code of Ethics also says that nurses have to protect our patients, our coworkers, the public from nurses affected by substance use. And the ANA Code of Ethics also requires employers to regularly check in on those who have recovered from substance use. Half of all nurses who attempt recovery succeed. And earlier I mentioned that 9,000 nurses re-enter the workforce after or during recovery. And this can be up to 18 million hours of direct patient care. If 9,000 nurses work 2,000 hours a year, that equals 18 million hours of direct patient care that we are gaining or missing out on when a nurse has substance abuse issues. Some barriers to effective recovery: poor mental or physical health, continued substance use, increased problem burdens. Specifically for OSF, we have a policy in place at OSF. It's policy number 365. You can look it up on the policy manager in the Mission Partner portal. OSF provides substance abuse assistance to any mission partner who admits having a drug or alcohol problem before being tested for drugs or alcohol. If you fail your drug test or your alcohol test and you did not ask for assistance before the test, you can be fired. But OSF also has this program in place called Last Chance Agreement that mission partners can participate in. It's, you admit, you talk to your manager, you talk to your supervisor, you talk to someone that is trusted. Admit that you have a substance use problem. And then that will, they will enroll you in the Last Chance Agreement, which requires that you participate in a treatment program. If you are found to have any drugs or alcohol in your system during work hours, it's immediate termination. After going through the treatment program, the mission partner is subject to random drug or alcohol tests for the next 60 months after treatment. Risks associated with medication diversion or substance use disorder. Harm to the patient. That's the number one thing. A nurse affected by substance use is altered on the job, which can lead to major errors for patient care. If the nurse is diverting drugs from the unit that they're working on, there's a risk that the patient can have a contaminated medication, which can lead to sepsis, wound infections, all sorts of things. For instance, if the nurse is using tap water to mix a medication instead of sterile tap water, and that patient receives that medication into their IV, into their muscle, it can lead to wound infections, like I said. Risks to the health, or to the addicted healthcare worker. There's risks associated with medication diversion or substance use, including criminal charges, civil charges, the State Board of Nursing might take action against that person's license or take their license away. But the big one for the addicted healthcare worker is death from unintentional overdose. Risks to your coworkers: if you are the affected healthcare worker, your coworkers have an increased instance of patient injury if you are not on your A game while taking care of your patient. The risk to coworkers: the medication counts are off. They could find you if you unintentionally overdosed. Employer risks: they are at risk for criminal or civil charges. And then the revenue from the diverted medication, because the patients aren't getting charged, and it costs your employer money. Some interesting facts I found. A healthcare worker in Denver, Colorado, passed on hepatitis C to 36 patients that they know of after diverting medication. Since COVID-19, there has been an increase of 30% in reporting substance use among nurses. This includes alcohol, cigarettes, and drugs. There was a 25% reported increase in alcohol use and a 2.6% reported increase in marijuana use. Nurses who have substance abuse issues have a higher incidence of compassion fatigue. 40% of nurses disciplined for substance abuse, used substances for chronic pain. Opioids are the most common diverted drug. Of the drugs diverted, they are normally not diverted to sell for financial gain. They are diverted for the healthcare workers' habit. Nurses are more likely to misuse prescription drugs rather than street drugs like cocaine or methamphetamine. And anesthesiologists, or CRNAs, have the highest incidence of addiction and diversion of all providers. Drug diversion violates the core value that the needs of the patient come first. My references. Thank you.